So I'm 30 weeks pregnant and I have a very sharp pain on the right side of my mid-back.
And you mentioned about that the sharp pain, it's worse at night?
Very, very worse at night, yes. I have difficulty breathing and it's giving me really lots of problems, yeah.
All right. Point to us, show us where do you feel that pain?
So it's in this area.
Mostly just right there, huh?
Yes.
So right now we're just looking for, is there any abnormal temperature? And we have one way down here. So let's look at the area we're complaining about. See, right now there's nothing here.
Right now it's not bothering me. It's just, I feel the tension, but it's not painful in these moments. But then at night it becomes crazy.
I understand that, but here's the interesting thing about it. This is the reason why instrumentation is important, and all the other indicators we use is that right now this instrument shows there's no abnormal temperature whatsoever in the region you're complaining about pain. So it's important to understand for the viewers, we don't chase pain at all. We go after the root cause, and right now what I'm seeing is this has an indication. So upon visualization alone, we can see that there's not much swelling on this side, and it's more prominent on this side. We got one big patch of fluid over here. And yes, I do see a little fluid here, but it's mostly as well, these are tight muscles here. See over here, this is all soft, and it gets tight over here.
Yeah.
And also tight over here. Tight, soft, tight. Soft, tight, soft. Alright? So, yes, I do understand. Yes, you do feel that muscle tightness over here. It can help explain that discomfort here. But I'm also feeling that there's just no edema here. That's another indicator I'm looking for. So, take a look over here. See, we got this huge fluid over here. Tender right here?
A little.
Yeah. What about here?
Yeah.
Yeah, see, this is all filled with fluid. This is edema right at the sacral iliac joint over here. Not too bad over here. But it is misaligned over here, the second sacral segment over here. And when we test it, how's that?
Yeah, a little bit.
Yeah, right? So let's check everything else. How's that?
Yeah.
See, everything else, this is a little bit stuck, more stuck, stuck. See, so everything's actually really coming from here. So, just want to let the viewers know, these x-rays were taken actually 3 years ago. And so this is clear way before her pregnancy. We tested, we confirmed on you the second sacral segment right over here, that's knocked out of alignment. And this one's very key because that's what establishes for the foundation for the rest of the spine over here. So because the way your spine is right now, like this, right, it slowly and steadily rotated like here. So because it got rotated this way, that's when we feel all that muscle tension going on over here.
Okay.
So it comes with no surprise while throughout the day, you're constantly using your body and just steadily rotates and twists. By the end of the day, of course, you're gonna feel all that muscle tension over there. So the answer is, yeah, we gotta realign the structure on the foundation itself, take all that tension off of the spine itself. Right? Another great benefit you also experience is that when the pelvis is proper alignment, and we also restore the nerve function from the brain into the pelvis, the uterus, yes, it's an organ, but it's also a very specialized type of muscle. You'll definitely find out in 10 weeks from now, okay, when you push that baby out. So when the uterus has sufficient enough nerve function and the pelvis in proper alignment, you'll find your first delivery much more easy to deliver the baby.
Oh, that would be great.
Right? As you see over here, this is uterus over here. You see these nerves?
Yeah.
Straight out to here.
Which is where I had the problem.
No, I'm just saying that this is the uterus itself. And they have nerve connections to the sacrum itself right over here.
Right.
So this region of the spine over here, so you see over here, the nerves are connected to that uterus. So yeah, it's definitely imperative to make sure you have proper nerve function when your brain and all shut down this uterus over here to allow optimal birth. So let it drop. Let it drop even more. Right here.
Oh, it's much more. I feel much less tension right now.
Where do you feel less tension? Where? Let's
Yeah,
show
in
to
the
viewers.
muscles, yes.
Point to the viewers. Where do you feel less
In
tension?
in the muscles here, they were the one hurting, and also this part. It's much more mobile.
Excellent. So I'm glad to hear that you already started experiencing some relief, right?
Yeah.
Just want to let you know for the next 10 weeks, your body is going to undergo a lot of changes, right? Don't be surprised that pelvis over there, it is going to move around a bit more, right?
Okay, yeah.
So we do recommend you're going to have some periodic checkups. Let's see how your nerve system's doing, and also the pelvis in proper alignment, so you can have a much more easier first time birth,
Okay.
right?
Sounds good.
Oh, you're very welcome. Well said.
Thank you so much.